Today we will see the remaining part of the analgesic antipyretic activity, the systemic action. Now, new topic is the systemic action. इकडे सरकवून इथं आहे का? Systemic action. First, analgesia. The first action is analgesia. Salicylate relieve the pain. Salicylate relieve the pain by mild to moderate pain. Moderate pain. The pain such as the pains like headache, muscular, toothache, joint pain. Generally these pain are used to bearable pain. Salicylate does not use for the visceral pain. These are commonly used mild to moderate. All these pain should be the bearable pains. You can bear it, but generally headache, muscular pain, toothache, joint pains. Salicylate is inhibiting the prostaglandin synthesis. These are the mechanism action. They are inhibiting the prostaglandin. Salicylate inhibit the prostaglandins. Okay. Now second action, antipyretic action. Antipyretic action. The salicylate reduce the elevated rise body temperature. They reduce the elevated rise body temperature. That does not affect the normal body temperature. Temperature does not fall down in the normal. Salicylate is act by resetting hypothalamic body thermostat for normal temperature. Salicylate act in the brain in the hypothalamic activity, that is the hypothalamic, the part of the brain, and then they act with the osmoreceptor and they control the temperature center and they reduce the body temperature. They are elevated, rise body temperature more than normal up to the normal body temperature. Up to the normal body temperature, and they act in the hypothalamic of the body thermostat control. It should be in the controlled by osmoreceptor. Next, third is respiration. Important. The salicylate increase the rate and depth of respiration by direct and indirect action. Direct and the indirect actions. They enhance the consumption of of oxygen by skeletal muscle, and this leads to increase the production of carbon dioxides and a high level of carbon dioxide stimulate respiration. And increase the rate of respiration and depth of respiration by direct action on medulla oblongata, which leads to alkalosis. These are seen in the examination. See, the salicylate act in the respiration by both actions, direct and the indirect action. Then they enhance the consumption of oxygen by skeletal muscle. Skeletal muscle are absorb the oxygen and simultaneously release the carbon dioxide. And the production of carbon dioxide increase, and the carbon dioxide production is responsible for stimulation of respiration. The rate and the depth is also increases, and the action produced in the direct action on the medulla oblongata, and they cause the alkalosis. In the alkalosis, what happened? In the very brief, alkalosis, it's a indirect action on medulla oblongata. Second, oxygen consumption, skeletal muscle, then production of carbon dioxide increase, and this carbon dioxide is responsible for stimulation of respiration and increase the rate and depth of respiration, and which cause the alkalosis, and by the direct action on abdominal medulla. Okay, is always asked in the examination, alkalosis. But after the high dose or prolonged use or exposure, the medulla is depressed. Then decrease the rate and depth of respiration, and this leads to respiratory acidosis. Previously you can just see the alkalosis, and here is the acidosis. In the alkalosis, increase the rate and depth of respiration. And acidosis decrease the rate and depth of respiration. It should be the direct action on medulla. Here is the indirect action on medulla. Indirect or maybe direct action. Here is the high dose. This causes the acidosis. Here is a normal dose. Oxygen consumption is increases in the body. Skeletal muscle are used and production of carbon dioxide increases, and then they cause the alkalosis. Here is decrease the rate, indirect or direct action on medulla, and then high dose causes alkalosis because of decrease the rate and depth of respiration. Next action, anti-inflammatory. Anti-inflammatory action. Salicylate is the high dose cause prominent effect of anti-inflammatory action. These are used in the rheumatic fever. Rheumatic fever and arthritis, Sandhyavat. Anti-inflammatory action is produce inhibition take place of prostaglandin, that is denoted always in the prostaglandin. They are the inhibition of the prostaglandin production. They inhibit the enzyme of cyclooxygenase enzyme. They stop the release and synthesis of the prostaglandin, and prostaglandin is responsible for inflammations. Okay. Now next section is uricosic effect. The high doses causes salicylate uricosic effect. High dose cause uric acid effect, and the low dose cause retention of uric acid. Next, GIT. Effect on GIT, gastrointestinal. Salicylate cause nausea and vomiting. Vomiting due to stimulation of chemoreceptor trigger zone. These are the center of nausea and vomiting, and it causes also the gastric irritation. Gastric irritation is caused the gastric irritation responsible for the nausea and vomiting, and then the salicylate directly stimulate the CTZ, chemoreceptor trigger zone. It's the center of nausea and vomiting, stimulate the cause nausea and vomiting. The salicylate is induce the gastric bleeding. Salicylate induce the gastric bleeding. Hence, therefore, those patient is suffering from the peptic ulcer, avoid the use of aspirin or use of salicylate or aspirin, not used for a peptic ulcer patient. These are contraindicated. Contraindicated. Those patients suffering from peptic ulcer, not use the salicylate because they cause the gastric bleeding, and they avoid it, and they are contraindicated. It is never used. Effect. Now next action, effect on the blood. Salicylates alter the bleeding time. Salicylate alter the bleeding time and by inhibiting the platelets inhibit the platelet aggregation. Thus, aspirin is useful in the treatment of coronary arterial thrombosis. Okay. Because they change the bleeding time, they alter the bleeding times, and they inhibit by mechanism behind that the platelets inhibition take place. They commonly used by the coronary thrombosis. Salicylate is well absorbed from the stomach. It is well absorbed in the stomach and small intestine. They are bound to the plasma protein. They are bounded to the plasma protein and distributed through the body tissues, all tissues. They across the placenta. The metabolized in the liver and excretion through the urine. Metabolism take place in the liver and excretion through in the urine. Adverse effect. The first cause, analgesic anti-inflammatory. The first adverse effect is nausea and vomiting. The salicylate cause the gastric irritation and cause bleeding. It is not used in those patients suffering from the peptic ulcer. Such patient is not used. These are the adverse effects. The high dose causes serious, toxic dose. High dose in the sense of toxic dose. Toxic dose causes acid-base balance. Acid-base and electrolyte disturb. Electrolyte disturb. They cause hyperpyrexia. High doses causes dehydration, gastric irritation and hemorrhage. action in the CNS. They cause vertigo, restlessness, hallucination, convulsion, coma. Convulsion and the coma. The high dose causes. Now, acute salicylate toxicity. The high dose causes, just you can see the high dose or toxic dose cause, just you see acid base imbalance, acid base imbalance, electrolyte disturb. It's also imbalance. This cause dehydration, GIT irritation, and finally hemorrhage in occur in GIT. And CNS effect is caused same, vertigo, restlessness, hallucination, convulsion, fit, coma, hallucination, avas, it's occur. Now because high dose is acute, then the treatment, how the treatment is given by using the treatment. For dehydration, immediate hospitalize and maintain the acid base balance, maintain the acid base balance, maintain and to administer the intravenous sodium bicarbonate. Second step, gastric lavage. You know the gastric, wash out the stomach by using the potassium permanganate. Those unwanted unabsorbed salicylate, it can be removed by the stomach. And third step, give the sedative, reduce the excitement of the patient. And fourth, forceful alkaline diuresis. Now the preparation and the doses. It's a common, aspirin is a well known, everybody knows the aspirin use. It should be available. Analgesic antipyretic for 3 to 1 gram is used commonly. Then salicylate, second, salicylate are used 250 mg to tablet, 750 mg tablets. Dose should be divided 3 times in a day. 3 times in a day. benzoate, aspirin and the paracetamol in the combination. Aspirin and the paracetamol using the combination. Dose is given 4 grams per day. Therapeutic use. Therapeutic use. It is used as analgesic. Relieve the mild and the moderate pains. Second, it is used as an antipyretic. It is used to raise body temperature decrease up to the normal body temperature. Second, it is used in treatment of rheumatic fever. It is and also used in treatment of arthritis. It is used in the treatment of myocardial infection. With the heart patients. It is also used in the treatment, used as an antifungal, antibacterial and catalytic. Next is amino phenol derivative. Example, paracetamol. Paracetamol has analgesic antipyretic effect like aspirin. Analgesic and antipyretic action similar to the aspirin, but paracetamol is weak anti-inflammatory effect. Paracetamol does not stimulate respiration, not stimulate respiration or acid base balance, does not affect in the acid base imbalance. It has not effect on cardiovascular system. Gastric irritation is insignificant. Gastric irritation is insignificant as compared to the aspirin. Aspirin causes the gastric irritation. That is a major adverse. It does not use in the peptic ulcer, but paracetamol does not show any gastric irritation. It does not cause the bleeding and is not used for urine or sick. It's a good effect. Paracetamol is well absorbed by orally, and it is conjugated with the, it metabolized in the liver, conjugated with the glucouronic acid and sulfate and excreted through the urine. Paracetamol having the very few side effects, adverse effect. As compared to the aspirin, paracetamol having the very few side effects. But prolonged use of paracetamol causes necrosis of liver cell, necrosis cell should be the dead. That is called the necrosis. The liver cell is dead. It may be suffering from the jaundice. That is a paracetamol. Prolonged use for continuously frequently use for a long period, then they cause the damage the liver cell and they produce the necrosis of the cells. You are suffering from the jaundice. Those patients suffering from the jaundice or liver disease never use the paracetamol.